Okay, this is my theatre preparation video. This is me preparing myself for a sterile procedure, scrubbing in to a certain procedure where I have to be a sterile nurse as well. So the first thing that I would always do would always be putting on my protective gear first, which that would include a mask and a cap. That way, after I've scrubbed, I don't need to be touching things that are non-sterile and putting them onto my face. So cap goes on, my hair is up in a ponytail, and I've got all my hair tucked behind my ears, or any loose hairs. So I put the surgery cap on and tighten it at the back, put it down. So making sure that any stray hairs are tucked away. Then put on my mask. Now, depending on what surgery it is, I could also put on some eyewear. So I'd tuck that around there and then cover my ears back up and just secure that in place to make sure that is in place properly. Okay, so I already have gotten out my sterile gloves, which I'll be putting on later, and I do also have a sterile gown. So obviously a non-sterile person will be opening these for me and leaving them on a surgical trolley that's already got a sterile drape over the top of it. But for now I need to scrub my hands. So I am removing all of my jewellery. And I do have a band-aid on my finger at the moment. So take that off. So we use these E-Scrub scrubs. So I do have a faucet here. It's one of those high ones where I can use my elbows to be turning on and off the cold water. I do start by turning it on and I do wet my hands. So when I am scrubbing, it is a little bit hard to show just by where the tap is. But basically when I'm rinsing my hands off, I know that I need to be keeping my hands elevated above my elbows, never leaving the water to drip down past my fingertips. Okay, so once I have wet my hands a little bit, I just wet them to start off with, just before I open this, so that my hands are wet and my forearms are wet for a nice lather to start up with the soap. So in this little kit here, I will leave the water running. In this little kit here, they have a blue nail picker. So just scrub underneath each nail, get any dirt and debris out from under all of your fingernails. If you have long fingernails, and even if you don't, you should be doing this step first as well. So under all fingernails. That is done. Now contact time I know is 6 minutes with the sponge. So the sponge looks like this. It's got one of that grippy side and then the sponge side. So just wet that a little bit. So I always start off with the fingers on one hand. So contact time is 6 minutes altogether. And I've been taught to do 10 strokes per side of the finger. So they're 4 sides, front, left, right, and then the back. So starting off with one side of each finger. And then going to the other side. And just continually scrubbing. So now the right side of each finger. And then the top of the hand, each finger. Okay, now the top of the actual hand of itself. and then the palm. And now at this point you never want to be putting your hand down. Get the wrist on 4 sides as well. So 1, 2, 3 and 4. And then I'll start with the other hand, do exactly the same thing, so 4 sides. Scrubbing at least 10 times on each side. Palm, the top of the hand, and then we can move down the arm, so 10 sides again. Okay, so leaving my hands upright, just drop that sponge, and now I'm going to rinse my hands, starting from the tip of my fingertips, leaving my arms upright to run down to my elbows and get rid of all of that soap. It's hard to video this part, but so always leaving the hand up and then doing the second one. So at this time I have dried my hands using a sterile hand towel, or I have used a hand towel that is wrapped into a kit. Someone has handed me out of the autoclave packet a sterile surgery gown. So these are folded in a particular way so that when we are putting them on, we have to hold it by the top here, drop it, and then we can easily move ourselves into the gown like this. Now you should always have assistance, someone helping you tie the back of it, and you should never expose your hands straight away, so always leave them under the cuff of the surgery gown until you're ready to put your gloves on. So a nurse should always assist by pulling it up and tying it around your neck. Okay, so now that I have the surgery gown fitted onto me, I can now put my gloves on. So I have my sterile gloves sitting down here on the surgery table. So the point is to keep your sterile hands on the inside of the gown until you're ready to put the surgery gloves on. So I would use my right hand to grab the underside of the left glove and start shimmering it over. So my hand, so nothing touches the outside of the gloves at this moment yet. So all on the inside, just like that. And then from this point, then you can pull them down like that, just like that. Now with the sterile glove, you want to grab the underside so you want to grab the outside of the right hand glove because this is your most sterile part of your body now. So underneath like that. So then we can separate it a little bit and start feeding our hand through. And then like that. So now we are prepared for surgery in a sterile procedure.